we are going to talk about periodontal diseases. All right, and of course, your key terms, you guys should be doing it on SurveyMonkey, pronouncing the words, defining the words. I'll be saying them here, and we'll be talking about the tooth structures, systemic factors, risk factors. We're going to identify 2 basic types of periodontal disease and 7 basic types and symptoms of them. And also, this lecture is like a part 2, but we'll do part 1 today. Starting with definition and prevalence of periodontal disease. Periodontal disease is an infectious disease process that involves inflammation. Periodontal diseases involve the structures of the periodontium, and periodontal disease can also cause a breakdown of the periodontium, resulting in a loss of tissue attachment and destruction of the alveolar bone. What is the periodontium? It's the structure that surrounds, support, and are attached to the teeth. So, if the doctor fails to recognize periodontal disease and he refers patients to a periodontist, is a common cause of malpractice lawsuit. Periodontal disease is a silent disease. A lot of people do not even know or are aware that they even have perio, of course, perio for short. Patients rarely experience pain and are often unaware that a problem exists until we get to the part that we will talk a little bit about later, where it gets to the part where their teeth are falling out of their mouth. Okay. Now, in this picture here, these are the structures of the periodontium. So please make sure that you open up your Kindle, look at it real closely, kind of notice all the structures. Some of them you're going to know. Things that are important always for us is the gingival margin. Okay, so that's where the crown is and where the gums meet. All right. Of course, we need to know the enamel of the teeth and the dentin and the pulp cavity. We actually spoke about all this other stuff before, so really make sure that you look at the picture and you kind of go over it again. Always review. Now, prevalence of periodontal disease. It is the leading cause of tooth loss in adults. So again, I mentioned this before. Almost 75% of American adults have some form of periodontal disease, and most are unaware of the condition. Almost all adults and many children have calculus on their teeth. The systemic connection. So chronic inflammatory periodontal disease may significantly affect health conditions such as coronary heart disease, stroke, or preterm birth. Chronic inflammation appears to do harm to the entire body. Certain systemic conditions increase the patient's susceptibility to periodontal disease. Periodontal disease may actually increase a patient's susceptibility to certain systemic conditions. So oral bacteria can spread into the bloodstream. It can attach to fatty plaques in the coronary arteries and contribute to clot formation and heart attacks. A lot of people don't know this. But, you know, our mouth is connected to our whole body. We also had a lecture on that, you know. We can't detach our mouth from our neck, from our torso. So whatever is going on in our mouth, it affects other parts of the body. And right here, it tells you that it can affect the heart, causing heart attack. So cardiovascular disease. Individuals with periodontal disease have a greater incidence of coronary heart disease. Preterm low birth weight. Women with severe periodontal disease have 7 times the risk of preterm low birth weight. Respiratory disease. Individuals with periodontal disease may be at increased risk for respiratory infection. What are the causes of perio? Biofilm. We spoke about this a day or 2 ago in, I believe it was chapter 13 lecture. So go back to that, please. But if you don't remember, it is a colorless, soft, sticky coating made up of communities of microorganisms that adhere to tooth surfaces, dental appliances, restorations of the teeth, the oral mucosa, the tongue, and alveolar bone. How is most biofilm removed? It's removed by brushing and flossing. How about that? A simple brushing and flossing can remove that biofilm. But when it's not, we will continue about what happens afterwards. Calculus, it provides a surface to which biofilm can attach, usually divided into two types. You have your supragingival calculus. It's found above the margin of the gingiva, so above the margin. Subgingival calculus on root surfaces are below the gingival margin that can extend into periodontal pockets. So here's your biofilm. They're showing the biofilm. That's that white that we talked about, that white colorless, soft, sticky coating. Okay, so that's over here. And then you just, it starts building up. Here's a way for you guys to see if you have biofilm on your teeth. Floss first. When you floss, you're going to see all this white stuff coming out. That's the biofilm. Once you finish flossing, brush. So a lot of people do it the opposite way. And so a lot of times after they brush, they won't floss. But if you floss and see all the stuff that you're getting out from in between your teeth at the gum line, then you will say, holy smokes, I need to floss on a daily basis, okay? Because number one, biofilm cannot be removed by rinsing, okay? And the other thing is that the first symptoms of gingival inflammation, like here, you see around the biofilm, around the gingival margin here, okay, it's starting to get red. So that's the first symptoms. Bacteria produce enzymes and toxins that destroy the periodontal diseases and lower the defenses. So as a dental team, we have to speak to our patients and make sure that if we see this stuff, we talk to them about improved home care. We have to explain to them instructions, using a soft toothbrush, how to brush their teeth, how to brush all the surfaces of the teeth, how to floss. So that's something that we will be doing also in lab. We will be practicing all that. Now, failure by the patient to improve home care, that's their negligence leading to the development of periodontal disease. Now, here's what happens when it starts building up. Okay, this is calculus. So a lot of people have calculus on the lingual lower anterior area. This is an area where a lot of times, due to the lack of flossing, the biofilm builds up, okay? And once it is on there, the calculus starts forming what's called a calculus bridge. And usually, these calculus bridge over here, like on the lower, see, they're separated. These are separated, but usually it forms one whole piece. Now, once this is formed, the patient cannot remove this at all. The hygienist will have to come in and do her magic by removing all these pieces, which are hard like a rock now. A lot of times, sometimes they chip off from the teeth and the patient thinks that their tooth chipped off when it was really the calculus. Once the calculus is removed, you're going to see the destruction that has happened underneath it. Teeth, as you can see already, the teeth have a lot of spaces, so they're probably already moving, okay? Now, there's other risk factors. Inflammation caused by an accumulation of bacteria in the biofilm. Disease-causing bacteria are necessary for periodontal disease to occur, but they are not totally responsible for destruction of the periodontium. Other risk factors alter the body's response to bacteria that are present in the mouth. So usually when people refer to periodontal disease, they are referring to adult periodontitis. But there are many, many other different forms of periodontal diseases. So periodontal disease is an inclusive term describing any disease of the periodontium, and it includes the following: gingivitis and periodontitis. Each has a variety of forms. So what's the difference between gingival disease and periodontitis? Gingivitis is painless, okay, and it often remains unrecognized. I mean, and at the point of gingivitis, you can turn back. But past gingivitis, Once you have periodontal disease, you always have periodontal disease. Even if you take care of it, you are more prone to getting it back. So you have to make sure that you stay up to date with the recalls that the hygienist or the dentist gives you. If it's every 3 months, every 4 months, whatever it is, you need to go. Gingivitis, in the beginning, they might ask you to come in 3 months and then every 6 months, just to make sure that you do not get past the gingivitis. Now, signs and symptoms of periodontal disease are red, swollen, or tender gingiva, bleeding gingiva while brushing or flossing, loose or separating teeth, pain or pressure when chewing, pus around the teeth, or gingival tissues. I have seen patients come into the office where they're talking to you and the blood is just like gushing out of their mouth. And I'm like, wow, they didn't see that, you know? And also, people who have periodontal disease have the worst breath ever. Why? Because it's an infection in their mouth. Infection doesn't smell good, okay? Pus doesn't smell good, okay? So they have the worst smelling breath. Now, gingivitis, that's an inflammation of the gingival tissues. Again, redness and swelling. There's a tendency for the gingiva to bleed easily. It's limited to the epithelium and gingival connective tissues, okay? And you know, again, look at your diagram to see where the epithelium and gingival connection tissues are. Here's gingivitis. So again, that biofilm starter, you can see that white sticky coating around. And if it's not removed, you get this red line around the gums, okay? With help from cleanings and you know, the brushing and flossing that you do at your house, this can improve and the gums can go back to pink. But when it doesn't, it just gets worse, okay? So gingivitis, again, other types are associated with the following: puberty. So when the kids go through their changes, they might have gingivitis type 1, pregnancy, use of birth control medications. Again, it's painless and often goes unrecognized until a dental professional emphasizes its importance, and improved daily oral hygiene will reverse gingivitis. Now, orthodontic appliances also tend to retain bacterial plaque and food debris, resulting in gingivitis. So whoever has braces or are in ortho care, any type of ortho appliances in their mouth, they should be actually visiting the dentist more often. A lot of them just go to the orthodontist, get their braces changed, just get checkups, and they forget about the cleaning. Okay, but it's important to let them know once you have the braces, you should be coming more often. And again, we should be giving these instructions to the patients to know. Now, here is medication-induced gingivitis. So certain medications also may cause gingivitis, as you can see here again, the red around the crowns of the teeth. Something is going on over here. If you guys take a look and look over here, okay, so some areas are a little bit worse than other areas. This area is super inflamed and puffy. Periodontitis means inflammation of the supporting tissues of the teeth, extension of the inflammatory process from the gingiva into the connective tissue and alveolar bone that supports the teeth.
You're not 160, right?
50.
150?
Yeah. Progression of periodontitis involves the destruction of connective tissue attachment at the most apical portion of a periodontal pocket. So at one time, it was believed that periodontitis progressed slowly and at a constant rate, and that all individuals were equally susceptible to periodontitis. This is no longer true. The current view of periodontitis is that the disease can take several forms. If you're doing your job at home by brushing and flossing and going to the dentist periodically, your gums should be super healthy. Okay, now the ones that haven't been going, haven't been brushing, haven't been flossing, almost usually those are the ones, those are the 75% that we talked about before. Cross section of a tooth. So if you take a tooth and you cut it in half, this is what it's showing you, okay? So on the letter A side is showing you normal gingival sulcus. So look at the gingiva over here. Look at my arrow. It's up here right where the enamel ends, where the crown portion of the tooth is. On letter B side, hello, where's the gingiva? Okay, the gingiva is no longer there. Why? Because that calculus buildup that I showed you earlier on the lingual, basically it destroyed the tissue, the bone. It basically pulls back because the gum, the gingiva, the tissue doesn't want anything to do with that. So it starts pulling back and it starts receding. It starts getting destroyed. Okay. And what happens is the calculus keeps on building up, building up, building up. Periodontal pockets, normal, healthy, is anywhere from 1 to 3. So this would be a 1 to 3. Here, Lord knows, okay, 5, 6, 7, okay, it could even go higher than that. Once it goes past this point, there is no point of return, because right here where the roots divide, this is called the furcation. Once the furcation is seen, usually this tooth is hopeless. It's usually rocking very easily. The mobility on it is just swaying in the wind, okay? Really look at this cross section on the tooth in your Kindle. Description of periodontal disease. Described in terms of severity and how much of the mouth is affected. You have localized or generalized. Localized meaning one spot, and generalized all over, okay? Severity determined by assessment of the amount of loss attachment, whether slight or early, moderate, severe, or advanced. The AAP, the American Academy of Periodontology, has identified 7 basic case types of periodontal disease, okay? To give you some statistics, in less than 30% of sites in the mouth are affected, that's localized. And if it's more than 30% of the mouth that's affected, is generalized, okay? So pretty much like I mentioned before, local areas, you know, here and there is localized, but all over the mouth, it's generalized. Now, here's some horizontal bone loss. So how do you get to see this? Of course, on x-rays. I mean, a lot of times you can notice it just by looking in their mouth from the spaces. But once you take x-rays, this is the bone up here, okay? And this is the coronal portion. So the coronal portion, the bone should be right at the coronal portion of the teeth. So again, the coronal portion is here, okay? And then the bone is way down here. So look at over here. This is horrible, okay? So here's the furcation that I was telling you. This tooth is goodbye, all right? Because it went under where the two roots divide. So usually this tooth is very loose, and it's hopeless at this case. This tooth would probably have to be extracted. I've seen some heroics out there. Some patients want to hold on to their teeth as long as they can. You know, as long as, I guess, you know, we can't make those calls, the dentist does. So, you know, and once the cleaning is done, but look at this one here. Barely the bone is holding this tooth right here. I mean, like a little tip. And this one is close to, I mean, all these 3. I have seen people lose so many teeth because of periodontal disease. Now, the 7 basic case types of periodontitis, you have your chronic periodontitis, slight or early, moderate, severe or advanced, and then you have your aggressive, which is your pubertal and juvenile periodontitis. You also have what's called your necrotizing periodontal disease, okay? NUG is necrotizing ulcerative gingivitis, and NUP, necrotizing ulcerative periodontitis. Please look in your Kindle because I saw some great pictures in there, or Google it so you can see it. Necrotizing, by the way, it refers to the localized death of living tissue. Anytime you hear the doc say necrotic, that means that it's dead. A lot of times they use the word necrotic because patients just don't know, and we don't want to be like, oh, tissue's dead, or the tooth is dead. So we use these terms of necrotizing for perio and necrotic for endo. So you will hear these words, please know them, okay? And again, Usually at this point, when it's this stage, it's time to extract their teeth. All right, that leads to, does anybody have any questions at this point?